Tumor markers. What is a tumor marker? A tumor marker is a substance produced by a tumor, benign or malignant, or by other cells in response to the tumor's presence, that can be used to differentiate a tumor from normal tissue, or to determine the presence of a tumor, based on measurement in the blood or various body fluids. However, tumor markers are not specific to cancer and can also be expressed by healthy tissues, although in much lower concentrations. Types of tumor markers: hormones, oncofetal antigens, lineage-specific proteins, cell-free DNA markers, mucins and other glycoproteins, enzymes, hormones. Certain cancers can cause high levels of hormones in the body, which can either be used as a diagnostic or prognostic indicators. Beta-human chorionic gonadotropin, elevated in trophoblastic tumors, choriocarcinoma and germ cell tumors. It is tested in urine or blood to assess stage, prognosis, and response to treatment. Calcitonin, elevated in medullary carcinoma of the thyroid. It is tested in blood to aid in diagnosis, check whether treatment is working and check for recurrence. Catecholamines, elevated in pheochromocytoma. Oncofetal antigens. These antigens are normally expressed during fetal development, but in certain cancers, there is a higher concentration of these antigens. For example, alpha-fetoprotein. It is elevated in liver cancers, ovarian cancer and germ cell tumors. To help diagnose liver cancer or germ cell tumors, and follow response to treatment, its levels are analyzed in the blood. Carcinoembryonic antigen. Colorectal cancer and cancers of lungs, breast, pancreas, stomach. Its levels are tested in blood. Lineage-specific proteins. These proteins are expressed in a cell lineage, or cell type-specific manner and can help in identification of the tissue of origin in metastatic cancers. For example, prostate-specific antigen, elevated in prostate cancer. Its levels are analyzed in blood. Monoclonal immunoglobulins, M protein, elevated in multiple myeloma, and other plasma cell disorders. Circulating tumor DNA markers. Circulating tumor DNA markers are fragments of DNA that contain specific genetic mutations found in cancer cells. Examples include epidermal growth factor receptor, shows mutations in non-small cell lung cancer and colorectal cancer. Tumor is analyzed for its levels. KRAS mutations in colorectal and pancreatic cancers, and non-small cell lung cancer. Its levels are analyzed in tumor and plasma. BRAF V600E mutation shows up in papillary thyroid cancer, melanoma, ovarian cancer, Erdheim-Chester disease, Langerhans cell histiocytosis, hairy cell leukemia, colorectal cancer, non-small cell lung cancer, and some other cancer types. Its levels are analyzed in tumor. Mucins and other glycoproteins. These markers are glycoproteins that show altered expression in cancer cells. Examples include CA125 is elevated in ovarian cancer. Its levels are analyzed in blood. CA19-9 is elevated in pancreatic, gallbladder, bile duct, and gastric cancers. Its levels are analyzed in blood. CA15-3 and CA27.29 are elevated in breast cancer. Its levels are analyzed in blood. Enzymes. Certain enzymes can be elevated in certain types of cancers and thus are used as tumor markers. Examples include lactate dehydrogenase is elevated in germ cell tumors, lymphoma, leukemia, melanoma, and neuroblastoma. Its levels are analyzed in blood. Alkaline phosphatase is elevated in liver cancer and bone metastasis.